My name is Peter Lubambi. I work with D3 International as a field implementer. Maybe I should start with telling you a little about D3. How many minutes do I have? 30?
About 20 minutes.
20 minutes.
Oh.
No,
Okay.
30.
Yeah, D3 International is an NGO which work in this field of IT health, specifically in mHealth, trying to improve the service of healthcare provided in our health facilities by using technology. And we use mobile technology because we believe that is scalable and it can be used across the country. There are other places where they have no access to power, but with mobile phone they can go somewhere and charge. I use it for a week maybe or 3 days. And in that area, we have also narrowed our scope. What we do, we develop electronic protocols. Health guys, they know what protocols means. These are like guidelines. In every area, there is guidelines which may be developed by WHO or Ministry of Health, which are on papers and books. So if you just see the HIV National Guide, it's a book that a 3-year-old child cannot carry. So we think by putting these protocols or these guidelines on mobile phones, on electronic forms, it makes it easier for health workers to follow the guideline and help them in making decisions. So we believe by doing so, someone from Newala can have the same, can access high quality of care as the person who is being attended by a medical doctor, a graduate who is in Dar es Salaam. That's what D3 does. Is there any question? Go ahead. Okay. So today we are doing a lot of projects around maternal health, HIV, nutrition, malnutrition. So we have some projects in Zanzibar on malnutrition. We have projects in Bagamoyo on maternal. And also we have this project on reducing maternal mortality in Zanzibar, which is funded by Bill and Melinda Gates Foundation. As you can see, these are women happy carrying a phone. That's the tool they use when visiting their clients. For this kind of projects, what's exactly what the problem? There is a low rate of in-health facility deliveries and access to postpartum care. So that was the problem we wanted to address. Regardless of the few health facilities we have, but still there are some people, they don't want to go to the health facilities. They decide to deliver at home. More than 1,000 women die every day in the developing world as a result of complication in childbirth. As we all might know, this is a big problem in developing countries. While in Zanzibar, where women are encouraged to deliver at the health facility, in Zanzibar, half of the births still take place at home, far from a skilled care. This is from the Demographic Health Survey 2010. Maybe why do these women decide to deliver at home? One is the insufficient knowledge. They don't know why they should go to deliver at the health facility. So they don't see any reason as to why I should go to the health facility, why there is a traditional birth attendant at home. So that's the one thing. Another thing is the delay in decision making. Some they know that I'm supposed to go and deliver at the health facility, but they don't know how to prepare themselves, and they don't make proper decision in time. So it happened they delivered at home. Also, lack of available finance for transport. Some they know and they did make a decision that I need to go and deliver at this facility. But I have no money. How do I go? How do I reach the health facility? So they decided to deliver at home. Further, 1/3 of Zanzibar mothers and newborns receive postnatal checkups within 42 days. So some deliver at home and they don't go to the health facility after that, because it's encouraged, even if it happened, the woman delivered at home should go to the health facility for postnatal checkups, but they don't. And some they deliver at the health facility, but once they leave forever. So this locks them out of opportunities to access postpartum care, family planning, because it's when they will be told about family planning once they have delivered, infant vaccination, and the other service to ensure their health future. So through the fund from Bill and Melinda Gates, D3 International is trying to address the problem in Zanzibar in collaboration with Etisalat through Zantel, Japaigo, and the Ministry of Health and Welfare. The solution itself is mHealth tool for community-based birth attendants. They are called TBAs. They are called traditional birth attendants. In Swahili, they call them wakunga wa jadi. So, D3 has developed an mHealth tool for traditional birth attendants who are well respected. You may not realize this, but TBAs are well trusted by the community and respected in their communities, and they have considerable influence and access over the mothers that are most likely to give birth at home. So with these women who deliver at home, when they think of delivering at home, they think of telling the TBAs. So that's why D3 decided to work with TBAs because these are the ones who have access to these women, are the ones who are well respected. So we have used the open source Java enabled application and the protocol which follows the Zanzibar means of wealth. The protocol, as I said, this is the guideline which follows the Zanzibar means of wealth guideline to allow these TBAs to screen pregnant mothers, to identify risks, danger signs, and discuss with these mothers about birth plans, and also secure permissions from their maybe partners, and also promote community-based referral systems. So by doing this, we address the issue of people not being able to go to the health facility because of not planning or of not knowing the importance of delivering the health facility. Also, it has established community-based referral system to transport laboring women to the health facilities in time and calling reliable drivers. So in this project, we work together with we have in touch with the drivers around the areas that we work on this project, where we keep their record of the communication, the contacts, and also these TBAs keep information about the contact information for the facility staff. So the TBA can arrange the transport for the woman, and also can alert the staff at the health facility that there is this kind of woman coming to a health facility, has ABCD. Using the mobile banking service provided by Zantel, the TBA can coordinate transport to the health facility. That means through this program, TBA can pay for the mother's transport to the health facility. So the mother doesn't worry about the finance to go to the health facility. Within 2 to 3 days after delivery, TBA follow up with the family to ensure a continuum of care, including postpartum and postnatal care. So the main focus being on prevention and integration, integrated with the health system, the tool which harness community actors to help mothers with the high-risk condition to access right care at right time. So they help them access skilled care at the right time. So in summary, D3's mHealth application for safer deliveries aims to improve identification of pregnant mothers' risks, improve decision-making for critical referral during labor. As I mentioned, the tool assists the TBA to identify risk and suggest decision. If the mother has a certain danger sign, maybe is having severe headache, the application suggests please refer this woman to the health facility. So the TBA can decide that this woman has to go to the health facility. Also improve coordination of the community and health facility actors. Through the communication, the TBA can call the health facility staff and alert about the women coming. Also increase the percentage of high-risk deliveries to be assisted by skilled carriers caregivers in the health facility. As I mentioned, the obstacles being one, some they have no access to finance for transport. So this program is providing transport. Also, some they don't have knowledge as to why they should go to a health facility. Through this program, through this application, the TBA train the women as to why they should deliver at the health facility. So more women now have to deliver at the health facility. Also, to increase the percentage of mothers and newborn attending postpartum care within first 7 days and after delivery. This project started around, went live around October 2011. Up to now, there is high demand of this tool. Traditional birth attendants, community health workers, and primary health care staff are using the tool for safe deliveries in North A district in Unguja, in Zanzibar. We have recently added Pemba. So based on the high community demand for use of digital tool, strong partner commitment, and promising results, the project has potential to extend across Zanzibar. Currently, we cannot tell from the data analysis because it has been less than 6 months. But telling from the qualitative analysis, we see the demand of this project to be scaled up to other areas in Zanzibar and in Tanzania. So that's a little about this project. So you can join us at Global Giving if you think this tool is helpful. We're also working with Global Giving to raise fund to support scale up for this project. Also, you can watch the video at YouTube, which just tell about the project.